Thank you, council members. Chris Gaal, Monroe County Prosecuting Attorney. I am here to give you an update on Adult Protective Services this evening. I had talked to Council Member Spoonmore about this, and he had suggested that I come and give you all a brief update about what's going on. This is an issue that I've been passionately concerned about and talking about for a number of years because Indiana has had a broken system for adult protective services, essentially too many cases, not enough investigators, inadequate resources. That's where we've been, is that our APS system has been overworked and understaffed and underfunded. And I've been co-chair of the APS committee for the Indiana Prosecuting Attorneys Council. For a number of years, I've been working on this issue at the state level for about 5 years, meeting with legislators and other state leaders to advocate for improvements to our APS system. And we're finally starting to see some progress at the state level. And I wanted to give you an update on those efforts so that you could understand the significance of what we're doing here in Monroe County and how that's significant for what's going on in the rest of the state as well. Because Monroe County is playing a key role as a model for improving APS throughout the state. So a little bit of background. In the 1980s, there was federal legislation that required states to create APS programs. Indiana decided that the most cost-effective way to do that, to avoid creating an expensive new state bureaucracy, was to contract that out, similar to the way that we do child support collections. That's contracted to prosecutors, and it's been a successful model. Indiana is support collections are up near the top in the 50 states. Indiana similarly contracted with prosecutors to provide adult protective services, which is a pretty unique model in the country. The way we do it in our state is it's divided into several multi-county hubs around the state. So what is APS? Just to summarize for you, APS receives reports of endangered adults. They investigate those reports and they determine whether or not someone meets the statutory definition of an endangered adult. And that has a specific legal definition in Indiana. An endangered adult is someone who's 18 years of age or older, who's incapable of managing their property or providing or directing the provision of their self-care. So in other words, they're incapacitated and they're unable to take care of themselves. And they're harmed or threatened with harm as a result of neglect, battery, or exploitation. So an incapacity could be something like a mental illness or a developmental disability or an age-related impairment like dementia or Alzheimer's disease, something like that. Neglect could include self-neglect, and in fact, most of the cases that we see involve self-neglect, someone who's unable to take care of themselves. And exploitation, as you hear it in the statute, that typically what we see is financial exploitation. So just to make this a little bit more human and give you some examples, imagine an older person who's living with dementia. They're living alone. There's no other family member available to take care of them. There's no one to help them. Essentially, they're living in filth and squalor. These can be some pretty heartbreaking things to encounter as an APS investigator. Typically, poor health, malnutrition, things like that. Eventually, it comes to the attention of a neighbor or a social worker or a medical provider. Somebody calls APS, and then APS gets that call, and the question is, what do we do? What's the plan? Another example, imagine a 40-year-old adult with a developmental disability. This is someone who, they're unable to care for themselves. They've lived with, say, their mother for their whole life. All of a sudden, their mother dies. There is no other relative. There's nowhere to go. There's no emergency plan in place. APS gets that call. It's not a safe situation. We can't just put them out on the street. We can't just drop them off at a shelter. This is a person with special needs. They need someplace to go. Another example having to do with financial exploitation, you can imagine that it may be, in fact, the family member who's responsible for the exploitation. That is not an uncommon scenario that we encounter. So, imagine an unemployed nephew with an addictions issue who's basically emptying grandma's savings account, draining her life savings, taking her Social Security check and using it for himself, essentially holding grandma captive. These are stories, but they're based on typical APS cases involving endangered adults that we encounter. And these cases involve our most vulnerable citizens in the community. So that's what APS is. What does APS do? APS has investigators that get these calls. They know how to go out there and gather facts, make home visits, gather information, document evidence, make a legal determination at that point of if someone meets that definition of an endangered adult. And if they are determined to be an endangered adult, then they assess the immediate safety needs, address any emergency needs, and then take whatever action is necessary, which could involve legal action. It could involve going and getting a court order, starting a guardianship petition, getting that ball rolling, developing a protective services plan in coordination with local, appropriate local agencies, making referrals to social service agencies, both at the local level and at the state level. And typically we work with a whole range of agencies involving things like the AAAs, the Area Agency on Aging, Stone Belt, Centerstone, medical providers. We have a volunteer guardianship program that's been started here now. The Bureau of Developmental Disabilities, which is a state agency. The statute requires APS to use the least restrictive services necessary. So it's not necessarily that someone's going to get placed into a facility. That typically is the last resort, but it could be that. It could be emergency placement in a group home or a nursing home or some kind of long-term care facility. But it could be just getting some support services in place to allow someone to continue living independently in their own home, or it could be finding another family member that's out of touch who is willing to step in and help. And if there is no appropriate family member available to do that, then finding someone, maybe facilitating the appointment of a guardian to assist that person to maintain an independent lifestyle. But anyway, once that plan is developed, once it's in place, then APS is also required by statute to monitor the provision of those services to ensure that the endangered adult actually receives those services and doesn't just fall through the cracks and disappear. So what's the problem now with APS? The problem in Indiana is that the APS, it was created in the 80s, and then the budget essentially stayed flat for about 2 decades. There was no significant increase in the funding. Meanwhile, the population grew. The percentage of the population that's age 65 and older grew significantly as the baby boomers retired, and these problems just kept getting bigger and bigger over time while the funding stayed flat, stayed the same. And those demographic trends are still continuing even now, so that by the year 2020, 62 out of 92 Indiana counties will have 20% of their population age 65 and older. So this trend is going to continue, and we began talking about this because it was a real crisis. There were too many cases, not enough investigators, inadequate resources, inadequate services available. What we used to say when we first started talking about this, the numbers were 40,000 calls, 10,000 cases, handled by just 41 investigators for the entire state of Indiana, trying to handle those caseloads. And so we were talking about it at first. Basically, no one paid attention, no one cared. But then, at one point, the Indianapolis Star did a week-long series of articles that was an expose of this, highlighting the problems, and the APS investigators were quoted in these stories. They were very frustrated. They were the ones sounding the alarm, saying, hey, this is a problem. This is a crisis that needs to be addressed. And then all of a sudden, with all that media attention from the Star, the governor and the legislature started paying attention, and they added some immediate new emergency funding for more investigators in 2016, and then that funding was put into the budget for fiscal year 2018, so that those funding increases became permanent. And with that new funding, we were able to add an additional investigator into each hub to address that understaffing and that overloading of those cases. And it also created a new position called the case monitor. And that is something that I really want to tell you about, because this is significant for Monroe County. This is a new position that does the follow-up work, basically, to ensure that when an endangered adult is referred for services, they actually will receive those services and they don't just fall through the cracks and disappear. And if there's a gap in services, then the case monitor can help us identify that gap exists, document that gap, and then we can do something about it. So this case monitor is a new idea. It's something that didn't exist before. I've had several prosecutors contact me to ask for the job description of the case monitor, because we wrote that job description and it's being copied around the state. People are looking to our APS unit to provide an example for what this new position will do. When the legislature addressed the emergency situation with this new funding, they made it very clear that any additional state funding increases going forward from now on are going to have to be data-driven. We're going to have to make sure that we are gathering that data. And so when I talk about identifying and documenting these service gaps, that's what's going to allow us to go back and then ask the state legislature for additional funding to address those problems in the next budget cycle. And my vision for this case monitor position is that they will not only be working with the investigators to develop an appropriate plan for protective services in these cases, and not only doing the follow-up on that service plan to ensure that people are actually receiving those services, they're being delivered, but also ensuring that this data is gathered and it's being entered into our case management system, and that then we're using that data to its fullest potential so we can address the service needs not only in our community, but at the level of the whole state of Indiana, by providing that information to decision makers at the state level. And I also envision this person in this new position doing the community outreach with service providers, coordinating our local resources, developing new resources as we need them at the local level and at the state level to fill those service gaps that we identify. So as a next step in our APS unit, which serves a 3-county area, it's Monroe, Morgan, and Owen, I would like to develop a multidisciplinary team, which is something that we do in other areas. We do that with our SART, our sexual assault response team. But the idea is it would meet monthly with the service providers in our community and talk about how we can work together more effectively, develop the resources that we need to better serve our community. And this case monitor is going to be key to making that happen in 2018. Unfortunately, the bad news is that the state funding that we got for this new case monitor position was only enough to create a part-time position. This needs to be a full-time position so that we can invest in developing a person in this position with the training and the skills, and then retain that experience to make this into a successful model for the whole state, not only for our community, but for the whole state. And we think we can make this into a full-time position within our existing APS budget. To do that, we want to combine the new case monitor position with another existing part-time intake specialist position that we already have, make those 2 part-time positions into 1 full-time with benefits position. So that the case monitor would have the additional duties of intake, screening, and opening cases, and the data entry into the case management system is already a duty of both positions, so that's kind of natural to combine those. I met with Councilmember Spoonmore about this. This is a proposal that we're going to be bringing to the PAC, the Personnel Committee, and we're not asking, I want to be clear, we're not asking council for additional funding at this time to do this, but we did want you to know about it because we are asking for your support for the concept within our existing funding from the state, recognizing that this new case monitor position will allow us to do something new and important and better serve a very vulnerable population, and that these are, these are real human beings that we should care about and ensure that our state is also addressing these needs. And I think this case monitor position it represents an important initiative, not only for Monroe County, but that Monroe County is leading the state with this initiative. And with that, happy to answer questions.
All right. Thank you very much, Mr. Gaal, for that thorough presentation. It puts what you are going to bring before PAC very much in context, so we appreciate that thorough picture.
Thank you.
Let's see if there are any questions while you are here. Let's start on the left and see if there's anything. Okay. All right. On the right.
All right, thanks.
All right. Thank you very much.